Hello everyone. Today let us continue with female reproductive system. So it is a continuation of last class. Okay. So today we are going to see about the disorders of female reproductive whatever the female or male reproductive tract. So disorders of reproductive system. Okay. So the first condition is chlamydia. So it is a microbe. Chlamydia trachomatis cause inflammation in the female cervix. Which ascend, that is go upward through the reproductive tract and cause pelvic inflammatory diseases and urethritis in male, which also ascend and lead to epididymitis. Okay, so chlamydia infection is often present in conjugation with other sexually transmitted diseases. Okay, next is the gonorrhea. So this is the most commonly occurring venereal disease caused by Neisseria gonorrhea, which affects the mucus of the reproductive and urinary tracts. So in male, the suppurative urethritis occurs and the infection may spread to prostate gland, epididymis and testis. So in female, the infection may spread from vulvar glands, vagina and cervix to the body, uterus, uterine tubes, ovaries and peritoneum. Okay, so this will ascend upwards. Next is the syphilis. So syphilis, it is caused by Treponema pallidum. After an incubation period of several weeks, the primary sore, that is a canker, that is a small what you can say inflammation like thing you can see appears on the site of infection. So where you can observe this means you can observe vulva, vagina, perineum, penis and around the mouth. Okay. So next is the trichoma vaginalis. So these are the protozoal causing vulvovaginitis, that is in the vulva region and vaginal region inflammation will be there. It is a sexually transmitted and it is commonly present in women along with gonorrhea. Next is the candidiasis. So the yeast Candida albicans, it is frequently a commensal. Commensal means both will be benefited in the normal vagina and causes without no problems. So it is normally prevented from the flourishing, example by vaginal acidity, but in certain circumstances it increases in its number, cause candidiasis. Okay, so common precipitating factors, normally this will be present in all the humans. So the count, if it is increases, this is called as candidiasis. So what you can observe during this infection, why it is coming means due to antibiotic therapy which kills the bacteria that keep the vaginal pH low. So if the vaginal pH is low, this organism will try to increase in its number. Next, in case of pregnancy and reduced immune system. Okay, so next is the acquired immunodeficiency disease, that is AIDS and hepatitis B infection. So I think hope you all study with this a lot and you can explain this. So even if it is not there, you can explain it from your pathophysiology. Okay. So next is the pelvic inflammatory diseases. So this infection, it may be specific or non-specific. So it usually begins as a vulvovaginitis including vulvar glands, then it will spread to the cervix, uterus, uterine tubes and ovaries. So upward spread is most common when microbes are present in the vagina before surgical procedure, childbirth or abortion, especially if some cases of products may conception are retained inside the uterus itself. So the complications of pelvic inflammatory diseases are, so it may lead to infertility due to obstruction. Next, it also lead to peritonitis, that is inflammation of the peritoneal region, intestinal obstruction due to adhesion between the bowel and the uterus and our uterine tubes. Next, bacteremia. So wherever the word ends with EMIA, it is related to blood. So bacteremia means increase in count of bacteria in the blood. So bacteremia, which may lead to meningitis, endocarditis or suppurative arthritis. Okay, Bartholin gland abscess and cyst formation if the duct is blocked. Okay, so Bartholin gland, it is present before vagina. So this will produce some watery secretions which will keep the region moist. Okay, so it will get blocked so that the secretions cannot be come out properly. So this will lead to abscess formation or pus formation or cyst formation if the duct is blocked. Okay, so with this, female reproductive system is over, and I think remaining a small topic is there which we can continue in the next class. Take care. Bye bye.